All right, hi everybody. This time around, I'd like to demonstrate point location for the kidney as it relates to the lower extremity, but with a prone patient, a patient that is actually face down. Okay, so let's start with kidney one. I'm gonna show the different body landmarks first. I think it's important, and then we're gonna cover them 1 to 10. Okay, so the first thing I'd like to show is, as it pertains to the medial aspect of the leg, we have the first metatarsal phalangeal joint. The prominence is right there. Okay, so the first metatarsal is actually proximal to that. I like to use two fingers. So one is on the bone, one is below it or inferior to it. This is where the spleen line is, and we're going to go spleen 3, spleen 4, and that's the base of the first metatarsal. Okay, so again, it's a little tricky here. Finding. Right there, that's the prominence of the first metatarsal base. Okay, looking for another important landmark, we can find the medial malleolus. The prominence is right there. Best to actually use a few fingers so you can really tell. Right there. And then we also have another important landmark, which I can definitely feel, wow, right there. Few fingers right there, that's the navicular bone. It's hard to miss. A few things about that area. We have important muscles that come up from the shin area on the front that are going down, like the tibialis anterior, which actually crosses over the shin bone. And then that's a prominence tendon right here, where liver 4 is going to be medial to it, okay? That one actually attaches to the base or under the base of the first metatarsal. Now, the tibialis posterior muscle that has to do more with point flexion and inversion is the one that actually goes right into the area of the kidney 2, which means it spreads on the medial arch at the area that is below the navicular bone. So we can actually affect the tendon as well when we go through kidney 2. Let's put spleen 3 and spleen 4 really quick. So again, two fingers going I would say inferior and proximal to the base, to the head of the first metatarsal. That's spleen 3. Spleen 4 is going to be more proximal, traveling up. That's already the prominence of the base, so we're going to go a little bit posterior, a little bit anterior and inferior, or distal and inferior. That's going to be spleen 4. And then as we make our way up the navicular process, that means that kidney 2 is going to be right inferior to that, or slightly inferior and anterior between the border of the navicular bone and the medial cuneiform. Yeah, so let's put kidney 2 here. I would usually kneel according to what's more reactive. We have A and we have B. Let's put it slightly inferior and anterior, kidney 2. Kidney 1, which I didn't mention, we have the second and third toes. The base of those are right here. There's about half between medial and lateral aspect of the foot. So this is one point of reference. The back of the heel is the second point of reference. That means that that's the line where we're going to find kidney 1. If we divide it into thirds, we're going to find where the anterior third and the middle third meet. That's going to be our kidney 1 right there. It usually works well because if we're going to do this one for a person, maybe slightly posterior, you can argue maybe a little bit more, but it's pretty much right there. Okay, we have the padding of the medial aspect of the big toe and the padding of the balls of the feet on the lateral. So right through there on that line right here. I'm a little bit off. Let's connect it again. Right there. Okay, kidney 1. Kidney 2, kidney 3 is easy. The prominence of the medial malleolus, the back of the Achilles, half the distance. This we have to stay within the same level. So I would keep that at about here for kidney 3. Okay. Don't want to kneel on the tendon. Don't want to be too close to the bone. That's a little too close. We have nerves under, so slightly behind it on the pocket level. Okay. There's 3 Zun measurements here. That's important to remember. So kidney 3, if we find the bone of the calcaneus, and then we go a little bit to the superior aspect right there, which is just below the kidney 3, we're going to find a pocket which is tender. That's kidney 5. So kidney 5, let's put it right there. It's approximately 1 Zun. Remember again, if that's 3, you see that comes to about a third below on that distance. So that's kidney 4, kidney 5. Kidney 4, which is the lower point, is going to be half the distance and then more posterior, so on the anterior border of the Achilles tendon. So we're going to be finding it right around there. Again, I'll go with the palpation to make sure that it's the most reactive. Maybe slightly posterior. You have some more room. Pocket. So 3, 4, 5. Kidney 6, that's the prominence. We want to be between the ligaments that go in that direction, like my fingers. We're going to find a crease. We're going to go into the sensitive crease. Okay? So let's find it. The prominence, I like to go about a tune below, which puts us around here. That's the crease. Right there, it's a tender area. Okay? That would be my kidney 6 here. It's not wrong to go even a little bit below the talus, like right there. If that's more reactive and tender, we can also put it there. It's very close. But definition-wise, it's between the ligaments. There's a little bit of a crease right there. Kidney 6. Kidney 7 and kidney 8 are going to be 2 superior to the line of the kidney 3. So above kidney 3, exactly 2 tune. If we do that one again, it's a little off there. But this is our 3 tune. Whoa, everything fell. That's going to mean that that's 1 tune, that's 2 tune. Okay? Going more posterior, so not on the tendon, but anterior to where we call the Achilles tendon structure is, we're going to find kidney 7. And then half a tune anterior to that, that's the shin bone already. We're going to go slightly posterior to it. That's going to be the level of kidney 8. Okay? Okay, let's double check ourselves. Prominence is right there. That's our 3 tune. Right there is kidney 3 supposed to be. It's about, you can argue that it's in the ballpark of 2 above 7 and 8. To find kidney 9, we want to be able to be 5 up from kidney 3. Let's put kidney 3 one more time. See if that can stay this time. Okay, and then we know that bladder 40 between the 2 tendons of the hamstrings is going to be here. That's also the crease of the knee joint. If we go more medial, okay, we need to find kidney 10 so we can establish that line. So finding kidney 10, let's actually flex it a little bit and have the patient just resist a little bit of flexion. Don't see it as much, but it's very pronounced to the touch. That's the tendinosis tendon. And then medial to that, we have another flatter, less noticeable tendon, but very noticeable between them. That's kidney 10 between those two. We have the membranosis, the flat one, the more pronounced the tendinosis, and then right smack in the center on the crease, relax your leg. That's where we're going to find kidney 10. So I want to put it right there. It's very easy to find palpation-wise when we flex the knee a little bit. So right there between the neck. If that's our kidney 10, that's our kidney 3, that's our line of the kidney. So we want to be able to talk or consider that to be about 15 soon. Spleen 9 is going to be 13 soon, but that's hard to exactly, where is spleen 9 here? It's not that easy, somewhere here. But if we look, if you can come from the top, we can demonstrate that, you know, the measurement of, we call it like the outer lower leg is 16. If we look into the knee joint coming from Xi'an or stomach 35, traveling alongside the edge of the knee joint or the knee crease to the lateral malleolus, that's our 16. But 2 things about it. One, this joint line is a little bit more superior to the medial joint line. That's number 1. And then also the lateral malleolus is a little bit more inferior to the medial malleolus, usually by about 1/3 to 1/2 tune. This is how we build. So it would be safe to say that if this is 16 here, that's approximately 15 tune, which makes our work so much easier because we have kidney 3, kidney 10. Let's make thirds, approximately on that same line, sorry. We're going to find kidney 5 right about there, which is 5 tune, sorry, kidney 9, which is 5 tune above kidney 3, okay? And I might be off a little bit. Why? Let's double check ourselves. Right there is my 3. Okay, let's double check myself. I might be a little bit too much. I would usually also look for some tenderness. Again, kidney 10, feeling pretty comfortable with that. Pretty comfortable with that. Right there. Alrighty, things move a little bit as we moved here. But again, 3, and then we have 7, 8, 9, 10. I hope we got it right. All right, Thank you.